give access to. Oh, you still presentation. Hi, Karmala. Hello, Parimala. Hi, everyone. Good evening. I request, except the speakers, I request everyone to mute your phones, please. And great evening to see you all on a weekend. This is Padmaja from Leisure Women's Wing. Hi, Parimala.
Yeah, shall we get started?
Yes. Yes, please. Go ahead.
Cool. All right. Let me just, all right. So thank you everyone, and welcome to the breast cancer myths. Hold on, sorry, I'm just getting sorted. Myths debunked event organized by Leisure Women's Wing. I'm Paris Watzenberg, your MC for the evening, and it gives me great pleasure to be introducing a fabulous team today to share with you the experiences and some more interesting facts about breast cancer and its awareness. Okay, a little bit about myself. I run a children's business called the Tiara Society. It focuses on creative and imaginative play and enrichment programs. And as I speak to you, there is an event just like right about going behind my back at the moment. Therefore, you see me kind of doing two things at the same time, but otherwise I am with you. Okay, now, this is a really personal topic for me as well, because I have my own brush with breast cancer. I've lost my mom 20 years ago to breast cancer, and I was a caregiver for 2 years. So I kind of like really feel for it a lot as well. But then again, most of us do know somebody as well, don't we? We all seem to have some sort of an experience with breast cancer, and that's how you know, important it is, because it's just all around us. And so this is a really important and good event. So let's start off with a big thank you. Maybe we can actually put up the slide as well. Do we have the slides to put up, Padma?
Yes, the first slides, right?
Yeah, we could put up the slides, then everybody knows the agenda as well.
Yes. Can I make you co-host?
You can.
Yeah.
Yep, sure. All right, so just going through the event. Nimi is coming in.
Hi, Parmala. Can you share the slides, please?
I don't have it on the laptop. I only have it on my phone.
Okay. Yeah, we will share it for you guys. Yeah, just give me 2 minutes. I'm doing it right away.
Okay. In the meantime, let me just share what Leisure is about. Yeah.
Yeah. Can you see
cool.
the? Yeah, this is the agenda. So.
Okay.
But
let me share a little bit.
Slideshow mode, please.
Let me share a bit more about Leisure's Women's Wing. Okay, the Little India Shopkeepers and Heritage Association's Leisure Women's Wing was formed on 12th of May 2012 by Mrs. Joyce Kingsley, and she formed her first executive committee and developed a concept for an ongoing monthly networking and awareness session and talks for ladies to showcase their products and giving them the space to showcase and sell their products, encouraging women to give inspirational speeches and also inviting experts and networking sessions. Leisure Women's Wing is organizing major events for LWW, Leisure's Women's Wing. So without further, I shall welcome Mrs. Joyce Kingsley, founder and chairperson of Leisure Women's Wing, to share her welcome speech with us. On to you, Joyce. You can unmute yourself.
Yeah. and we'll give access to Joyce.
Thank you so much, Parimala. A very, very good evening to everyone. It is really very nice to meet all of you through this event. Today's topic is one that is ought to be touched year after year, breast cancer awareness. Just like what Parimala said, we may know of our loved ones who may be affected by this, or even survivors who tell their life story, yet we take it very lightly or neglect to take precautions or test on ourselves to be sure that we are fine. Many of you may have questions or doubts on issues related to these. We hope today's event will bring clarity and hope to all of you. As such, we are truly honored to have Dr. Akhil Chopra and Dr. Lynette Goh to bring us through this topic. On the behalf of Lisha Women's Wing, I would like to say a big thank you for your valuable time spent with us to create awareness. Thank you so much, Dr. Akhil Chopra. Thank you so much, Dr. Lynette Goh. Ms. Neha Bondi, thank you so much for coming forward to share your story. Truly kind of you to create awareness with your experience. I am pretty sure it will be very inspiring for all and bring hope to many. Looking forward to hear from all of you speakers. We had plans to do this event in the month of October in time for Breast Cancer Awareness Month, but concurrently, we were also organizing many Deepavali fringe events, like, for example, How I Celebrate My Deepavali, featuring 12 different Indian ethnicities on their practice and beliefs. And also like Deepavali sweets and savories, how to make almond badusha, ghee balls, and mami murukku. And also like Deepavali TikTok challenge, Little India Biryani Fiesta 2021. So what I've mentioned is only 4 out of the 12 fringe events that we organized in the month of October. And I particularly mentioned these 4 events because I need to highlight that the organizing chair of today's breast cancer awareness, Batmacha, was also heavily involved in the 4 events that I mentioned earlier. So you can see the drive and passion in her for community service. I should say that today's topic is something of her special interest as well. Thank you so much, Padmaja, for putting this interesting and informative event together. And our MC, Parimala. She is always a darling to support Lisha Women's Wing events. Such a lovely and generous soul who never took at time or cost to help us out. Parimala, you are amazing, and thank you can't be said enough to you. I would also like to thank the Breast Cancer Foundation for supporting this event. Also, thank you to Lisha, the main Lisha, and Lisha Women's Wing Executive Committees for their unending support. Without further ado, I would like to hand it back to our MC so that we can hear from our speakers. Happy holidays to all of you. Stay safe and happy, and remember to go for your checkup. Thank you so much, everyone. Over to you, Parimala.
Thank you. Thank you so much, Joyce. It's always so lovely to hear from you. Okay, so without spending any more time, let's move on to inviting Ms. Stephanie Lim. She's the acting head of advocacy and communication, Breast Cancer Foundation Singapore, and she's going to share her insightful thoughts of BCF and their initiatives with us. On to you, Ms. Stephanie.
Thank you. Thank you, Parimajala. Hello, good evening to everybody. Thank you. Thank you for inviting Breast Cancer Foundation to share on the services of Breast Cancer Foundation. And I will also share with you a little video on mammogram and me. Let me share screen now.
Yes. Can you see
All good?
Yes.
Okay, good. Okay. In February this year, World Health Organization has declared breast cancer has overtaken lung cancer as the most common form of cancer in the world today. In Singapore, breast cancer is also the most common cancer among women. This is published in 2019 by the Singapore Cancer Registry. Each day, 6 women in Singapore are diagnosed with breast cancer in Singapore. There is this misconception that breast cancer only affects older women. The fact is, younger women, when diagnosed with breast cancer, they tend to suffer from more aggressive form of breast cancer. Therefore, we can't emphasize enough on the importance of breast cell examination and early detection. As mentioned earlier, younger women tend to suffer more aggressive form of breast cancer. This is a BSE code which is done by Breast Cancer Foundation. You can scan it, and then it will be a guide on breast cell examination. So, and you can also do a mammogram screening at the polyclinic of your choice. Now, where do you go for your mammogram screening? It is available at selected polyclinics. These are for Singaporean. It's very, very heavily subsidized. Restructured and public hospital, private clinics and private hospitals. It is also available at mammo buses, deployment at community centers, or sometimes special arrangement by private companies. Now, what is the cost? For first-time screeners for above 50 years old, first time, it is fully sponsored by Breast Cancer Foundation. So if you are blue or orange CHAS card holder, do come forward and get your first time screening. You can call a hotline and make your appointment. And for Pioneer generation, it's only $25. Medical is $37.5. CHAS card holder for orange and blue is $50. So if there's any permanent residents tonight, this evening, it's $75. So you can always call Breast Cancer Foundation and we'll be able to provide you with all these costings. Now I'm going to share a little bit about Breast Cancer Foundation. We are a social service agency established since 1997. Our mission is really to advocate early detection of breast cancer and to support the breast cancer community. Okay, social support for the breast cancer community. Our members consist of women diagnosed with and breast cancer survivors and volunteers. We have programs and activities that are crafted to suit their needs. We also have monthly support group reaching out to the English and Mandarin speaking, young women, caregivers, and advanced cases. We have got the Befriender program. Basically, these are breast cancer survivors trained in basic counseling skills. They are there to give emotional support, and befrienders are matched according to the patient's profile. We have Healing Through the Arts program, which comprises of dragon boating, outdoor training, we have yoga, Pilates, Qigong. So do come and join us. Okay, we have this special week loan program where we offer a complimentary week loan services, and this helps to restore self-esteem as well as rebuild positive self-image. We also have a caregiver support group. As much as a patient needs support, I think we all know that caregivers need support as well. So caregivers are there to share their experience and provide emotional support to one another. How do you want, if you want to get involved, how do you go about it? Call a hotline or just make an appointment and come by. Our volunteers come from all walks of life, ranging from student, working professional, organization, and survivors. Now, we are pleased to share with you that we have just moved to a new center. It is at Sin Ming Avenue, very near to the Thomson shopping mall. Okay. Yeah. What is Breast Cancer Center? It is an integrated space with a comprehensive and holistic suite of breast cancer support programs and services. Do note, it is a safe and non-medical environment for the breast cancer community to forge friendship and care network. So do note that we are a non-medical environment. Like I mentioned earlier, we have programs ranging from counseling, image workshop to week loan, physical strength activities, art and sewing classes, We do conduct quite a fair bit of nutrition talk as well as cooking classes. Currently, it's all virtual, and we have got mental health resilience skills as well. So it is a dedicated center to engage the wider community through past events, present events, as well as we do a lot of talks. Some of you probably come across the pink ribbon. This year, 2021, we have launched a collector's set. It is, the pink ribbon is basically an international symbol of breast cancer awareness. It symbolizes solidarity with the breast cancer community to fight against breast cancer. This year, BCF, that is Breast Cancer Foundation, we have launched the Pink Ribbon Collector's Edition, featuring 10 unique ribbons from the past 20 years collection. So if you are interested, do call our hotline, or you can go to our website and find out more details. Some of you may have heard, we have the Pink Ribbon Virtual Walk. It's from 1st to the 31st of December. Well, this is the first time we're doing it virtually. So we're having the light up of the Malayan. It's going to be in pink from the 1st to the 15th of December. Do drop by, take a picture, sign up with us, and do join in solidarity for the cause of the walk. Now, as you are aware, Breast Cancer Foundation, we are self-funded. You can support the work of Breast Cancer Foundation by making a donation. So this is the UEN code. Lastly, notes to all women out here, we are always too busy with our families, work, children, but it's always the last to take care of ourselves. So do note, never be too busy to do your breast cell examination. When you're sipping, think of how to keep yourself in the pink of health. Always remember, catch it early, treat it early. With this, I'm going to end my presentation, and the team will share with you a mammogram and me videos. Thank you.
Thank you so much, Stephanie. Now, would you like us to show that video, or do we?
Yes,
you would
please
like
show the video because my side can't play.
All right.
Thank you.
Okay. Padmaja, is there somebody playing the video? So I'm just thinking, whilst waiting for the video to come on, if it's going to take a few minutes, maybe just does anyone have any questions for Stephanie? Anybody would like to hear a little bit more, any other information that you want to hear from Stephanie based on what she has presented as well?
Maybe to share a little when we play the mammogram and me, my colleague will put it into the chat, so our can download it and then watch it later. Maybe Mala, can we maybe go on to the next speaker and then we play it later? For the,
Okay,
yeah.
sure, I
Hi,
think that's fine.
just give me a minute. Can we make Alicia the co-host and where she can play it? Do you
Yeah,
want to
she's
do
already
that?
sharing.
Yeah.
This is the
that's
video,
great.
yeah?
Yeah, yeah.
There's no audio.
There's no audio, is it?
Yeah, no audio. Alicia, there's no audio.
Sorry, just give me a minute, yeah?
X-ray machine
Yeah,
gently
yeah.
the breast between please.
Just hang on a minute. Let me share again. Okay, it shall work now. Sorry for the hiccup.
Did you know
Every day, 6 women in Singapore are diagnosed with breast cancer. This means early cancer detection is important as survival rates are lower at later stages. With that, let me introduce mammogram screenings, the most reliable form of breast cancer detection. It detects lumps before you feel them. Mammograms are low-dose X-ray examinations of the breasts. The X-ray machine gently compresses the breasts between 2 plates and takes multiple images. Each image is taken in less than 1 minute. You might feel some temporary discomfort during the compression of the breasts. Now that you understand what mammogram screenings are, what's next? How do you schedule a mammogram screening? Mammogram screenings are available at various hospitals, private clinics, and polyclinics. Women 40 and above are recommended to go for routine mammogram screenings. And the cost? Don't worry, you'll be glad to know that mammogram screenings at polyclinics are subsidized for Singaporeans. Before your screening, do follow these tips. Schedule it 7 to 10 days after menstruation, when your breasts are least tender. Wear an outfit where the top and bra are easily removed. Remember not to wear jewelry, powder, deodorant, or antiperspirant. Regular mammograms are the best way to detect breast cancer early. Early detection and treatment will increase the chances of recovery. It is also important for all women to perform monthly breast self-examinations. Look out for signs and symptoms that may require prompt medical attention. Before attending your mammogram screening, ensure you're not pregnant and you've not been breastfeeding in the last 6 months. So book your mammogram now and remind your loved ones and friends to do so too. Remember, early detection saves lives, saves breasts.
Thank you for sharing, Stephanie. That was lovely.
Thank you.
All right, moving on. Yes, Stephanie, did you want to say something?
No, thank you.
Thank you. All right, moving on. We have Dr. Akhil Chopra. He is currently with Infocare Cancer Center at Mount Elizabeth Hospitals. He was previously a senior consultant in medical oncology at Johns Hopkins Singapore Tan Tock Seng Hospital. And he was an adjunct associate professor at Lee Kong Chuan School of Medicine as a senior specialist in cancer medicine. He has wide experience in managing cancer patients from around the world. He has been involved in teaching medical students from Lee Kong Chuan School of Medicine, as well as medical residents and students from Johns Hopkins University, Baltimore in USA. And on a personal note, Dr. Chopra is married and has 2 amazing young girls. His hobbies include a passion for aviation and playing golf. And handing over to Dr. Chopra to talk and share his insightful thoughts. On to you.
Good evening, Pramila. Thank you very much for the kind introduction. I hope I'm loud and clear. I haven't had a chance to play a lot of golf during the pandemic, but I hope to get back to it once things get better. I do want to take this opportunity to thank Padmaja for this invitation to this enlightening discussion we're all going to have this evening. To Joyce and of course Stephanie from the Breast Cancer Foundation. I'm quite impressed with what the work goes on thanks to the Breast Cancer Foundation. So, I mean, ideally, as interactive a discussion as possible would be beneficial to all participants, but I thought I'll take some time to just go over some basics with the help of a small PowerPoint presentation. And I think we're even more lucky to have Dr. Lynette following me. She's a senior consultant, breast oncologist, and definitely much more experience than me. And I'm sure she is going to share her thoughts as well. And there might be a slight overlap in our presentations. We apologize for that. So maybe I can share my slides now. Yeah, am I the host now?
You would like to share your screen, right?
Okay. Okay. So the topic for today is breast cancer cure myths debunked. So some of this we just heard from Stephanie, as well as the interesting animated video. So I'll try and skip through this very quickly. But breast cancer continues to be a big problem, unfortunately, not just in Singapore, but all across the world. It's the commonest cancer in women in Singapore in all age groups, as shown by this table from Singapore Cancer Registry monograph that was recently published. In addition, the numbers have been going up every year, and this is due to many causes. I think what is reassuring is that the majority of the cancers are still diagnosed in early stage, stage 1 and stage 2, which allows us to increase the cure rate. And as this table tells us, even though the breast cancer incidence is increasing, the survival from breast cancer is also increasing thanks to newer treatments which are available. So this is very reassuring. So what are the signs and symptoms of breast cancer on presentation? Again, as alluded to by the previous speakers, any palpable lump in the breast is always concerning and should be evaluated quickly. But breast cancer can present with there's some nipple discharge or diffraction of the nipple, or just thickening of the skin and change in color of the skin. My take always is there any symptoms or anything that doesn't feel normal to a woman should be evaluated as soon as possible. In terms of making the diagnosis, again, breast self-examination, as highlighted before, is paramount importance. Mammograms and ultrasounds are imaging techniques that help screen asymptomatic women to pick up hidden breast cancers or precancers, and this has really led to majority of the breast cancers being diagnosed in early stage, at least in the West and Singapore. MRI breast is a more enhanced imaging technique, a more sophisticated technique that is sometimes used in younger women with dense breasts. So that's done on a case-by-case basis. But the diagnosis of cancer is never established just by imaging. It always requires a biopsy, which is essentially taking a small piece of breast tissue that is either felt palpable or by image bandings. And this tissue is then looked under the microscope to confirm the diagnosis of cancer. So what are the breast cancer risk factors? There are quite a few, but I think we need to remember that just having a risk factor doesn't equate to developing breast cancer. You may have a risk factor, more than one risk factor, and never get breast cancer, or you may not have the traditional risk factors and unfortunately still develop breast cancer. So I think the importance lies in knowing which risk factors can be modified or reduced by an individual. So some risk factors that we can't change, obviously being a woman increases your risk of breast cancer, but men do get breast cancer, much less frequently, of course. But interestingly, when they do develop breast cancer, it's usually more advanced and more aggressive because there's not a lot of breast tissue, so the cancer tends to spread very quickly. Age is a common risk factor for all cancers, including breast cancer. So the older you are, the higher the likelihood that you will develop cancer. And this is seen across all cancer subtypes. Race can be a factor. At least we know in the West, white women tend to have a high incidence of breast cancer. The reason for this is not exactly clear. Family history is an important risk factor. FDR stands for first degree relative. So if you have one first degree relative with breast cancer, that increases your risk 2 times. If you have 2 first degree relatives, it raises your risk 3 times. If you have a family member who developed breast cancer at a young age, that also increases the risk. Or if you have a family member, male family member with breast cancer, that increases the risk. More and more, it is becoming quite obvious over the past decade that cancer is a genetic disease. And approximately 10% of women or men with breast cancer, they the cancer is largely due to an inherited mutation from one of the parents. And the two most established and research mutations are in the BRCA1 and BRCA2 genes. And this is now a routine part of our workup in someone who has recently been diagnosed with breast cancer. Not just from the, not just to understand why the person got breast cancer, but also from the standpoint of treating the cancer, as well as from the standpoint of siblings, children, or parents who may still be alive. Dense breast tissue seems to be an increased risk factor for breast cancer. There are some hormonal factors that I will discuss in my next slide. History of certain benign breast lesions like ADH or ALS can increase the risk. And the hormonal risk factors include early onset of menses or late menopause, women who have never been pregnant or had their first child after the age of 25, or prolonged use of hormone replacement therapy more than 5 years, which can increase the risk by about 30%. And all these are related to increased exposure to hormonal cycles with estrogen and progesterone. What about lifestyle-related factors? So alcohol has shown to be consistently linked with not just breast cancer, with other types of breast cancer. It doesn't seem to be related to the amount of intake. Obesity, especially in postmenopausal women, is known to be a risk factor, and reduction in physical activity or reduced physical activity is a risk factor. So this is obviously a modifiable risk factor. A very common question that patients ask me, as well as relatives and friends, are there any dietary factors that increase the chance of developing cancer or breast cancer? And this is not very clear cut, and most studies are inconclusive. There doesn't seem to be unequivocal evidence to say that a diet rich in fruits and vegetables reduces your risk of cancer. Fat intake, there is no clear link. Red meat and processed meat, unlike some other cancers like colon cancer, again, for breast cancer, there's just a weak evidence showing a potential positive link. And of course, we do know vegetarians, and of course, we also get breast cancer. I won't bore everyone with this slide, but essentially what we have come to realize in the last 20 odd years is that breast cancer is not one disease. There are many types of breast cancer, and it's incumbent upon the treating physician or oncologist to classify or subtype what exactly is the type of breast cancer, so that the best treatment or the personalized treatment can be offered to the patient. Today, when someone is diagnosed with breast cancer, we do some additional tests on the breast cancer tissue to look for hormone receptor positivity and HER2 positivity. So based on these results, there are at least 4 different types of breast cancers which have been highlighted below. And this is more important for treating physicians like myself, so that we can offer the best type of treatment to the patient. So this is quite standard, it's been standard for the past 2 decades or so. There are 5 stages of breast cancer. Another question that is frequently asked, obviously, what is my stage? And this depends on the size of the tumor, and I have some pictures to show after the slide. The involvement of the lymph nodes, which are small structures in the armpit, in the middle of the chest that the cancer can spread to. And of course, if the cancer has spread outside the organ or outside the breast to other organs such as the liver and the bones. But more and more of the past decade, we are incorporating other factors in staging, including the hormone receptor positivity, which is termed ER and PR, HER2, which is a gene that is amplified in about 20 to 25% of all breast cancer, and the grade of the cancer, meaning how aggressive it looks under the microscope. So this is essentially stage 0 breast cancer. So as you can see, the breast is made of ducts and lobes, which and glands, which essentially produce milk. And the cancer usually would start either in the cells lining the glands or the ducts. And this is a cross section of a normal duct. You can see one line of cells, and when one of these cells develop or becomes mutated and develops into cancer, that's how breast cancer starts. Now, if the cancer cells don't invade through the duct into the surrounding breast, that's called stage 0 breast cancer, and these are highly treatable and curable. About 25% of all breast cancers that are diagnosed by mammography today are considered to be in stage 0. So stage 1 breast cancer is further divided into 1A and 1B, and I think this is not so important for today's discussion, but essentially as the cancer size increases and the cancer starts spreading into these structures called lymph nodes that look like green peas here, the stage increases. So you can see in stage 2, there is clear evidence of the breast cancer having spread to these lymph nodes in the armpit or near the breastbone. And in stage 2B, the size is larger. In stage 3, the size is even larger, more than 5 centimeters, and more lymph nodes are involved in the armpit. And in the stage 3B, sometimes the cancer cells can invade into the skin of the breast, causing this shiny kind of appearance, which is obviously quite concerning. And in stage 3, the cancer cells would spread to more distant lymph nodes. And unfortunately, if the cancer is still not diagnosed, the cancer cells will find a way to invade into the blood vessels and then spread to other parts of the body. And this is termed stage 4 breast cancer. Just quickly, in terms of treatment, the treatment has really changed over the past 2 decades, which has obviously led to improved survival. Essentially, breast cancer is treated by a combination of surgery, which is probably the most important component of the treatment, chemotherapy, targeted therapy, immunotherapy, which are drugs essentially used to kill the cancer cells, and then radiation therapy, which are powerful X-rays that are aimed at the area where the breast cancer was to reduce the risk of the cancer coming back. And then hormonal therapy is a very important component of the treatment for those cancers which are hormone receptor positive. Now, you could start by giving chemotherapy before surgery, especially if the cancer is found at a later stage and is quite big. Or you can start with surgery first if the tumor is small, and then give additional treatment. The purpose of this treatment that is given after surgery is to reduce the risk of the cancer coming back. And this also depends on the subtype of breast cancer. So chemotherapy has got a bad rap, and there are a lot of misconceptions out there, but there are still very effective medications to treat cancer. These are just 2 of the most common types of chemotherapy that we use in breast cancer: anthracyclines and taxanes. Interestingly, taxanes are actually derived from plants, which is a lesser known fact. Now, the biggest concern for most women I treat is obviously hair loss. It is the most feared component of side effects of chemotherapy. But again, I want to re-emphasize this is fully reversible, and most women will get all the hair back. We do have some new techniques to try and reduce the chance of hair loss. This is just one of them, where we have a cap that goes on the head of the patient, cools the scalp, and this prevents damage to the hair follicles while the patient getting chemotherapy. But I would make a point that is, in my experience at least, and I'd love to know what Linus' thoughts are, it's only effective 50% of the time. And it doesn't seem to have a negative effect on the treatment, so that is very reassuring. So most of my patients definitely give it a try, but if it doesn't work, then they stop using it. myself and Dr. Lynette as oncologists, we have to assess every patient, their cancer, the characteristics of their cancer, and basically determine what is the risk of the cancer coming back after surgery, for example, and come up with a personalized treatment plan to give the best chance of cure for our patients. And this incorporates a number of things such as the size, lymph node status, the age of the patient, the grade of the patient, the biological features of the patient that I discussed in the previous few slides. The other point I would like to make is not every woman's breast cancer requires chemotherapy after surgery. And this has been a relatively recent development and a very important development, because we all feel in our profession, we probably had been using chemotherapy excessively in the past years. But now we have these sophisticated tests that we do, one of which is called Oncotype, where in certain subgroups of breast cancer, we can determine with quite good accuracy if chemotherapy is really going to help our patient. And if it's not, then we don't have to give it. And we can discuss this more if there are any questions about this. Again, the silver lining on the cloud is that a lot of women are being cured of breast cancer today, even though the incidence is going up. So we have a lot of breast cancer survivors, and that's great. And it's important, to continue living a healthy life even after this diagnosis. Do whatever you can to reduce the risk of recurrence. And we all want our patients to get back into their lives, to their professions, to their family as soon as possible after this devastating diagnosis. And some lifestyle changes can have an impact because of what we had discussed previously in terms of the risk factors. So weight management, exercise, control of your other chronic medical conditions such as diabetes, reduction in alcohol levels, reduction in stress. Yeah, that would be great if we could do that. All these make an impact. So the second part of my talk, just quickly, is to discuss some of the myths. And I had to actually do a Google search to see what are the breast cancer myths that are frequently circulating on the internet. So these are some I found. Finding a lump in the breast means you have breast cancer. This is obviously not true because there are a lot of benign conditions in the breast. And this requires appropriate evaluation and biopsy sometimes. As I had already mentioned, men do get breast cancer. It doesn't only affect women. Another myth is the mammograms can actually cause breast cancer to spread because it squishes the breast tissue, and this is totally false. Family history is important. It can increase the risk of breast cancer, but this is not inevitable. This association is not inevitable. Breast cancer is not contagious, so women are not going to pass it to their spouses and their children and their parents. Clothes or bras, antiperspirants or deodorants and powder do not increase the risk of breast cancer. And finally, radiation from mammogram does not cause breast cancer. In fact, the radiation from a screening mammogram is really minuscule. So these are the things I had found, but I'd love to be part of a discussion if there are any other myths that I haven't addressed. I think that's my last slide. Just a quick overview. Thank you for your attention.
Thank you so much, Dr. Akhil.
Thank you.
That was awesome. So much information. Now, how's
Yes.
everybody feeling? I'm getting nervous. I feel like I need to do a mammogram right away. How's everybody feeling? Anybody has any specific questions? No? Okay. Thank you. Thank you so much. Moving on, let's next have Dr. Lynette. Are you ready, Dr. Lynette? All right, just a quick introduction.
I hope you can hear me.
Okay, Dr. Lynette, we can hear you. We can hear you. Right. Dr. Lynette is a medical oncologist who specializes in women's cancer, breast and gynecologic cancers, including ovary, endometrial, uterine, and cervical cancer. Dr. Lynette graduated from NUS in 1996. She pursued a Master's of Medicine and obtained her membership of Royal College of Physicians in UK in 2002. Doctor has areas of interest in doctor's areas of interest are in breast cancer, hereditary cancers, and genetic counseling, psychological and oncology, palliative medicine, in addition to general medical oncology. She has completed the intensive course in cancer risk assessment at the City of Hope Hospital in California, USA, from 2017 to 2018. And Dr. Lynette has also established the Hereditary Cancer Risk Assessment Clinic and genetic counseling in Raffles Hospital. So let us all join into welcoming Dr. Lynette. Dr. Lynette, on to you.
Thank you so much, Parimala. Thank you for the kind introduction, and it's a great privilege for me to be here. Thank you, Lisha, for inviting me, and great to link up with Breast Cancer Foundation as well. It's raining cats and dogs at the moment. I think Dr. Akhil Chopra has done a very good job summarizing the entire breast cancer treatment. He's done my job. So what I'm going to say is probably a repetition. And so I'll just try and get over it quickly so you don't fall asleep.
No, I'm sure. We could hear it another time as well.
Okay. All right, I think mine is a little bit simpler. Okay. So I'll basically be going through the risk factors of breast cancer again. What are some of the common signs and symptoms and how we make a diagnosis of breast cancer? I guess repetition is the mother of memory, so we'll hear it again. So as what Dr. Chopra mentioned earlier, risk factors does not equal you definitely get breast cancer, but this increases the risk of developing breast cancer. So let's look at what some of the risk factors are. So that brings us to some polls. So here, here's a question. Underarm antiperspirant causes breast cancer. Do you think that's true, false, or not sure? Maybe if you could put your answer in the chat box. Okay, and here's another question. Wearing a bra to sleep at night. My daughter told me this. Wearing a bra to sleep at night increases your chances of getting breast cancer. Is that true, false, or not sure? What do you all think? I think we've got a very well-informed audience here. So most people wrote false. Okay, so I'll move on to the talk. So there was a study this year in the US where they looked at thousands of women with breast cancer and they looked at their risk factors. And after analyzing them, guess what is the biggest risk factor for breast cancer? Well, the biggest risk factor is age. So,
oh no.
So a woman 70 to 74 years of age has an 18 times higher risk of developing breast cancer than a woman 30 years of age. And if we look at the incidence of breast cancer according to the age, we notice that the incidence of breast cancer starts to rise from the age of 40 years onwards, peaking at 60 to 70 years of age, and then slowly decreasing from there. So we all can't avoid aging. It's something that everyone goes through. But what we can do is we could screen ourselves at the appropriate age groups so that we can assess and evaluate for possibility of breast cancer. So the general recommendation is a screening mammogram from the age of 40 years old. Usually we do that once a year, and from the age of 50, once every 2 years. If there is a strong family history of breast cancer, then we might need to screen more frequently or with more intensive modalities of investigation like an MRI scan. Unfortunately, in Singapore, only 20% of cancers are found on mammogram. In some of the more mature countries, they found that up to 40% of non-palpable cancers are found on screening. And that's what we hope to achieve. And that's what I think Breast Cancer Foundation has also been trying to achieve. And what's the second most highest risk factor for breast cancer? Would be a gene mutation in the BRCA1 and BRCA2 gene. So in the 2012-2013, scientists were investigating families with very strong history of breast cancer, ovary cancers, and they found that these families in which cancers run in the family, they all had a change in their gene. And these were usually in chromosome 17 and chromosome 13, which they eventually named the breast cancer gene or the BRCA gene. So women with the BRCA gene mutation had up to 87% risk of developing breast cancer. So do we all need a gene mutation to see if we have this gene mutation? Not really. So anyone with a very strong family history of breast cancer or breast and ovary cancer, men with breast cancer, or those with an Ashkenazi Jewish heritage should see a genetic counselor and consider doing a genetic test. And a genetic test basically means just sending off saliva or blood or even a buccal scrape, and they would analyze all the genes related to an inherited gene mutation. So we can't really change our age or the gene mutation that is inherited, but what we can prevent are risk factors that have been shown to increase the risk for cancers. And the preventable risk factors that are strongly associated with cancers include cigarette smoking, excessive body weight, and alcohol. So in 2020, American Cancer Society came out with a guideline for cancer prevention. And for breast cancer, they recommend that we should all engage in at least 150 to 300 minutes of moderate intensity exercise a week. That means about 3 days of exercise a week. We can also modify our diet to avoid or reduce red meat, sugar-sweetened beverages, highly processed foods like ham, sausages, and refined grains. As it's been recommended not to drink alcohol. Now that is very, very tough. The alcohol industry is very strong worldwide. So they've recommended that if we cannot avoid alcohol, then we should at least limit alcohol consumption to not more than 1 drink a day for women and 2 drinks a day for men. So back to our question, does underarm antiperspirant cause breast cancer? I think none of the studies have shown that this is related to breast cancer. And wearing a bra to sleep at night, also no evidence that that causes breast cancer. So what are some of the signs and symptoms of breast cancer? I'm sure most of you already know, but that brings us to the third question. If a breast lump is painful, it's more likely to be cancer. Is that true, false, or not sure?
Can everyone add the answers on the chat, please?
So just, I think about 2 weeks ago, I actually had a couple of patients who made appointments to see me because they developed breast pain and they were so worried that they had breast cancer. Is that true? Yes, our very knowledgeable audience again mostly answered false. So here are some of the common signs and symptoms, most of which Dr. Chopra has already gone through. Well, the most common sign and symptom is a lump in the breast or under the armpit, and most of the time it's painless. It could be nipple discharge or bleeding, or just a change in the shape or the contour of the breast. Sometimes the nipple may be inverted, but pulled in by the tumor underneath, or the areola, which is the skin around the nipple, gets crusted or changed in appearance, or the entire breast may just look red and inflamed, and we call that inflammatory breast cancer. So if the breast lump is painful, a lot of the times it may not be cancer. A lot of the times, painful breasts are because of hormonal changes. Some women develop breast pain just prior to their menstrual cycles. It doesn't mean that if it is painful, it is not cancer. However, if the breast lump is not painful, it's a red flag that it might be something serious. We find that a lot of breast cancers are painless and hard. And some of the other myths, some women say, oh, it can't be breast cancer because it's just a rash. If you notice on the picture on the right, this rash has eroded into the entire nipple. It's one of the more rare breast conditions we call Paget's disease of the breast. So that can be cancer as well. And some of the young women mentioned that, oh, I can't possibly have breast cancer because only older women have breast cancer. We see that the incidence of breast cancer is the highest at 60 years old, but I'm only 30 years old. But the truth is that breast cancer can occur at any age. And as what Ms. Stephanie mentioned earlier, the incidence of breast cancer in young women is slowly rising. Even men can get breast cancer, so we must always be aware. So how do we make a diagnosis of breast cancer? Well, mainly the three main modalities are mammogram, a breast ultrasound, and a biopsy. So that brings us to our fourth poll. A lot of women tell me, oh, I don't like to do a mammogram because it's very uncomfortable, it's very painful. Can't I just do a breast ultrasound for breast cancer screening? Do you think that can be done? What do you think? Could you put your answers in the
Let's
chat
see,
box
what
below?
answers do we have?
Can we substitute a mammogram with a breast ultrasound?
No.
Oh,
I said
a
no.
lot of people say no. Well, let's see. So this is a mammogram machine that we've seen through at the PCF video earlier. So basically, it's just a very simple X-ray machine. It has very, very low dose X-rays, 0.6 millisieverts, no more than standing outside in the atmosphere for 3 months. So barely any radiation, don't have to be afraid. But what we do is that in order for the X-rays to penetrate the breast, we need to distribute the breast tissue out. And for that to be done, there's a plastic paddle above the breast that compresses the breast. So that may cause a little bit of discomfort. And what we see on the mammogram, two important things we see on the mammogram are a breast mass. So if you see a rounded nodule or a mass, that could mean something serious. Or more importantly, we look for microcalcifications. These are little specks of calcium. We see it as white spots, little white spots all over the mammogram. And if they are clustered together, that could be an indication for an early breast cancer or pre-cancer. And when we want to pick up cancer from screening, we want to pick it up at a very early stage. In the pre-cancer stage, stage 0 or stage 1, that's when we can actually cure the cancer. So a mammogram is important because it picks up abnormalities that are very, very early. Unfortunately, some women have dense breasts. As you can see in the picture here, the entire breast is all white. So if there's a microcalcification or a mass there, we can't see anything because everything is white. So it covers the abnormalities. This is usually seen in young women, and this is because there's a lot of mammary tissue inside. As a woman ages, the breast tissue actually becomes fattier. So there's less mammary glands and it becomes whiter. So therefore the X-rays can penetrate the breast better, and then we can pick up any abnormalities. So usually in young women, a mammogram may not be so useful in detecting abnormalities. We may need to add on other modalities, such as a breast ultrasound. So in a breast ultrasound, it emits ultrasonographic waves, and this is reflected back into the receptor, and we see it on the image. So a mammogram is usually an add-on, an ultrasound is usually an add-on to a mammogram. And the reason why we can't use an ultrasound in place of a mammogram is because an ultrasound would pick up nodules, cysts when it has already occurred. but it seldom picks up pre-cancerous abnormalities like microcalcifications. So can we replace a mammogram with a breast ultrasound? I'm afraid not. A mammogram does have its place in picking up very early cancers or pre-cancers. And if we do see an abnormality on a mammogram or an ultrasound, then we want to confirm this with a biopsy. A biopsy is simply a needle that's inserted to the area of abnormality where the tissue is actually removed, and then the pathologist looks under the microscope and confirms whether or not they see cancerous cells or not. And that basically brings me to the end of my very short talk. So yes, breast cancer is the #1 cancer in women in Singapore and worldwide. 1 in 13 women will be diagnosed with breast cancer in their lifetime. So if we understand the risk factors, we can reduce our risk factors. And if we continue cancer screening, we can pick up cancers at a very early stage, and early detection is the key to cure. Thank you.
Thank you so much, Lynette.
Thank you.
Now, does anybody have any questions? I don't think it was, I think it was good sharing it again, Lynette, and it was in a different format as well, so it's good. More information is good.
Yep.
All right. Yes, you wanted. Let's see. Okay, next we have. Next we have Snehal Pandey, Life and Career Coach. Sneha, are you ready?
Yes, I am.
Welcome, Sneha.
Okay.
Snehal, right?
Yes, Snehal.
And I mean, just do me a favor and introduce yourself as well, please. A little bit more. Tell us more about yourself.
Yes, I will. Do I have the rights for just putting on the presentation? Yeah.
Yes, Snehal, you can go ahead.
Okay, I don't seem to have the rights.
Just give me a moment. Snehal, can you try it out now? We have given the rights. Just try it out.
It's not showing.
Still not there?
Yeah.
Okay. Yeah, and meanwhile, while we try out to give you the rights to co-share, Dr. Akhil and Dr. Lynette, it was so nice of you to come on a busy weekend, and it was so insightful sharing. I myself, I was thinking, like, you know, I was so scared, and I was so worried to go for a mammogram. And a few years back, I had this, like, you know, one of the doctor, as after hitting 40s, I was just asked to go, and you know, they told me that there was a minor lump or so, but it was gratefully after the second, you know, after the second mammogram, everything is all right. But that made me to, you know, take this forward and share it with all the ladies, how scary and how it can be very for a person, you know, who doesn't have it. And but everything, I think every year I suggest every woman should go after hitting 30s. What do you all say? Do you agree that we should go for mammogram?
I think so, but after 50 years old, you can do it once every 2 years if it's normal.
Okay. But it's so painful and so scary. I personally, I felt like, you know, I'm not going to do it, but I was like, yeah, it was very painful. I think later I'll ask you in the Q&A session why it's so painful. So again, not taking much time, Snehal, please go ahead if you can.
Yes.
No?
Thank you
Yeah.
so much.
Thank you.
Okay, so hi, good evening, guys. It's great to be here, and thank you so much for having me here. I want to share my story today with you guys because I hope it makes some difference to all of you in any way possible. So this is us, my family, me obviously center stage, my husband, who's my hero and my ultimate cheerleader. He's also here with us. He's joined us for this talk. And the comedian of our family, that is my kid. This photograph was taken last year in July 2020, and my kid was about 3 months old at that point of time. Life before this, born and brought up in Mumbai, did my engineering to make my parents happy, did my MBA to make myself happy. Me and my husband are complete thrill seekers. We love roller coasters, we love bungee jumping, skydiving, you name it. We are completely adventure geeks. So our next adventure happened somewhere in December 2019. We got an opportunity to move to Singapore. And when we did move, I was 6 months pregnant at that time. And you know, a couple of months down, April, we had our baby. To say the least, my breastfeeding journey was very uncomfortable. Now, a lot of women do, you know, complain about it, sleepless nights, painful sometimes, and so on. And, you know, that's what I believe too. What used to happen is my left breast constantly remained engorged. It never settled. And whatever I did, I tried heat packs, I tried massages, I tried, you know, every 2 hours pumping, you know, whatever people would tell me I would try to do. But it just didn't settle. And that time the circuit breaker was on. So I did not even want to either go to the hospital or, you know, call someone home. I was like, you know, I'll figure it out myself. Finally, in August, it got too much. You know, it was so many months down, and you know, and my supply was going down. So I finally decided to call a lactation consultant home, and she thought it was mastitis when she saw it, and she, you know, she gave me a breast doctor's number and said, you know, why don't you connect with her? She'll help you with the situation. And I said, you know, why not? I went to her, and I remember during the ultrasound when she saw it, and you know, she happened to mention that it doesn't look like a blocked milk duct. Let's do a small biopsy. So she did, you know, she took a syringe and she removed a bit of the tissue and said, you know, why don't you come back in a couple of days? When I did go back a couple of days, I remember her receptionist calling me and telling me, why don't you bring your husband along? And I thought to myself, why did she need my husband there, you know? But then I thought maybe it's like a Singapore thing. So, you know, I didn't really, you know, say too much. You know, we just moved countries, and, you know, it was a completely new environment for us, you know, back then. And she said the dreaded 3 words, which I never thought I'd hear in my life. You have cancer. Couple of months down, not couple of months, sorry, a few days later, with a lot of tests and a lot of things, I was detected with metastatic breast cancer. Basically, that means the cancer had spread to the lungs, my liver, and the bone. And it was inflammatory breast cancer, which, you know, Dr. Lynette just spoke about. I was 37 at that point of time. My baby at the point of detection was 5 months old. And in terms of family history, no family history at all of cancer. I did not know anybody, even remotely, friend circle, family, extended relatives. I knew nobody who had cancer. So this actually came as a huge shock for all of us. Since then, till date, my recovery journey, I've had almost 24 sessions of chemotherapy, of 3 different types of drugs, each drug which has been stronger than the other, each drug leaving me far more weaker every time, with a little more nausea, a little more bloating, a little more weakness. A lot of fears, of course. I think the first, you know, when somebody tells you that you have stage 4 cancer, I think it was like it was almost like a movie. You see this only in movies where somebody tells you something like this. And I first thought, I'm going to die. That's it. I'm going to die. There's no two ways about it. And I remember the doctor telling me at that point, that don't worry, don't get paranoid, that, there are a lot of advancements that have been made in this field. So, don't overplay it in your head. With chemotherapy, something that the doctors have mentioned, which is completely reversible, I know that. But, when I was going through it, when I was losing my hair, I was losing my eyebrows, eyelashes, everything, my body image took a huge toll on me. They say that you should love your body through cancer. But when you don't recognize your body, when you don't recognize the person in the mirror, how do you even love it? How do you love this Nehal who for 37 years you saw someone else and now you see someone else? So, my entire self-esteem took a huge beating at that point. And then came the chatter, the internal chatter we do to ourselves, that what will people say? In Hindi, they say, log kya kahenge? What will they talk about me? Will they say, oh, poor thing, oh my God, what a tragic story. How sad is that? And all these judgments, for all, people are not thinking anything, but this was all going on in my head. And of course, the last thing was my future. My baby was 5 months old. My husband, me, I had so many questions in my mind. What would happen? Would I be bedridden after this? Would I be dependent on people after this? What's going to happen to my career, me, my family, everyone? And of course, the treatment so far has been very sinusoidal. So it's been like a complete roller coaster. It was almost like God telling me, you love roller coasters, I'm going to give you the roller coaster of your lifetime. So I've gone through a lot of different treatments. I started with hormonal therapy that Dr. Akal had spoken about. And, my cancer started coming back. So I went through chemotherapy. The cancer went back down. Again, we switched to hormonal therapy. The cancer went back up. Again, we had to go through chemotherapy. The cancer started going up. And now I'm on my third drug of chemotherapy. And we will get to know in December what is the progress and what are the next steps for us. Basically, it's been 15 months since my diagnosis, and we're still counting. But they say all challenges in our life teach us something. They come into your life to be teachers. And what you learn from it is basically how you decide to react to all of this. Oh, by the way, this is my photograph of me with that cooling cap, which Dr. Akhil spoke about. I have used it like all through and I have about, I know it's about I have about 30% of my hair still left. Okay, so what cancer taught me? I think the first thing it gives you when you think that you're going to die is it gives you perspective on life. It basically starts telling you what's important to you, and who is important to you. What do you really want to spend your time on? My chemotherapy sessions are every 3 weeks, and out of which 1 week, because of the chemo session, I'm down. So I have typically only 2 weeks where I'm in a really good state. Good state, I would say, is not like my perfect state, but I still have a lot more energy. Who I want to spend it with, who are the people important to me, what do I want to do with that time? What kind of lifestyle changes do I want to bring in so that, I get better, quicker, faster, and, keep it at bay forever. I think the next big thing cancer taught me was that I should ask for help. We're always told that, asking for help is a sign of weakness, asking for help is, why do you need help, right? You can solve it yourself. All your problems you can solve yourself. But I realized that when I did ask for help, people came from all corners to help me out in their own way. My first and foremost was my family. I lost my mother a couple of months before my baby was born. So my mother-in-law had come over to help us, last March, and she's still with us right now. It's almost going to be 2 years. My father-in-law is alone in India. They have practically stopped their life for us, so that me and my husband can focus on my treatment, and my helper and my mom-in-law help us with the baby. BCF, this was the first thing my doctor told me to get in touch with. And I have never looked back. The kind of support that they have given me till date, it's immense. I started off with something called as the Befriender service that they have, where somebody with cancer, who has had cancer in the past, journeys with you. Because, in the first 3 months, there are so many questions you have. Plus, we were in a foreign country. In India, we would have figured out doctors, hospitals, insurance, everything we would have figured out much faster. Here, since we had just moved, it was so difficult for us, but there were a lot of inputs that we received, a lot of help I got. All the nervousness, worries that I had, she would always be there just a call away from me. BCF also does webinars, on things that help cancer patients, like gut health, bone health, insurance, a lot of these topics which are important for us. And of course, they have a support network, which is like just a WhatsApp away, which completely helps me when I have any question. Like recently I asked something about sound healing and I got like 2-3 responses within like 5 minutes. It's insane. And then of course are your friends, right? You always wonder which of your friend is going to be there for you in your darkest days. And honestly, all the friends I expected to be there were there for me in their own way, but everybody stood up and, they've been there for me through this entire period. And some of them have joined this call as well. I would also like to make a special mention of my counselor. I've been in therapy since my diagnosis in a way. This is something that in my head, I had, put a stigma to, saying that, I don't need counseling. I'm fine. And I remember my friend, she's actually my best friend, who had reached out to me, who is a counselor herself. And she was like, let's talk. And I said, I don't need counseling. What do you need counseling for? So I was like, I've accepted it. I'm undergoing treatment. We're going to be okay. And she said, let's talk and let's figure it out. And you don't have to go through counseling. You just talk to me. And honestly, I think that was the best decision of my life, because she helped me deal with cancer in a positive way. She helped me, firstly, I think my biggest victory was when I accepted I had cancer. I think, when you have any challenge in life, our first way of dealing with things is denial and distraction. You distract yourself so much, you'll keep yourself so busy because you don't want to think about it. You don't want to talk about it. And because it scares you, right? So she helped me deal with this in a way that was, positive and a more effective way. And then I realized that, it's a complete mind game. Somebody had told me that, that cancer is a mind game. And it happens, right? Your mind and body are connected. Your mind gets shocked, your body will freeze. Your mind gets nervous, you will get butterflies in your tummy. So there's a lot of connection there that happens. So it's how you decide to keep your mind, no matter what's happening to your body, somewhere you will be in a different place. And I think that's what I learned through these 15 months. It's resilience and just the faith and belief that things are going to be fine. But I think the last, and I think the most important for me is what my husband told me. I always tell him, in India, we have this, characters called Vikram and Betal. Vikram is the king and Betal is a ghost. And the ghost is always giving him stories and giving him moral of the stories and things like that. So he's like my Betal, always on my shoulder, trying to tell me things in a way that will make sense to me at a point of time. So I remember I was going through one of my darkest periods, and I go through that on and off, of course. Life is, for me, is obviously not a bed of roses. I have my down days when I feel completely victimized. I feel completely alone. And it was during these times when, we had to go back into chemotherapy and, things were just, the cancer was so aggressive, it just keeps coming back. And I told him that, I don't know what to do. What should I do? And he just said that, what are you waiting for? You always have told me you want to do something with your life, but you seem to have gone into some sort of a shell and you don't want to come out of it. You feel that when your treatment is done, you will do this. When everything gets over, when you're in remission, you will do this. But you have 2 weeks every time and you don't do anything with it. And I remember thinking that, yeah, that's so true. And so early this year, along with my treatment, I began my coaching journey. It is something I had started even earlier in life, about 5 years back, but I took it again because I've been really passionate about it. I decided to do my credentialing to be a life and career coach. I also took up a 3-month certification to be an NLP practitioner, which basically supports my coaching journey. I also became a blogger. I blog about my cancer journey. I blog about things that matter to me. And I think the biggest win has been just speaking about it, like in a forum like this. It takes a lot out of me to speak. It takes a lot out of me to even be here. But I feel that if I can make a difference to anybody, in some way, I think it's my discomfort is, it's worth it. It's worth that entire feeling I get that, oh my God, what am I doing, what are these people thinking about me right now? So to close, there's a moral of the story that I that I want to share. You know, in every when you go on an aircraft, I know a lot of us have not gone in a very long time, but when you go onto an aircraft, the first thing they tell you is put on your mask first, and then put on help your kids. You know, as women, we are so used to this. We are just so used to, you know, being there for other people and not doing enough for ourselves. But I think it's time we do that. Charity begins at home. Start with yourself. Take care of yourself, guys. Protect yourself from breast cancer. As the doctors have said, early detection can really help. Thank you so much.
Thank you so much for sharing, Snehal.
Thank you.
I think I'm lost for words. That was amazing. Your sharing was amazing, and the whole experience. So I think at this point in time, if I don't know who's on the video call, I think all of us feel the same way, and wish you all the best. I'm sure it's going to get better. I mean, I don't know if I have the right things to say, but you know, we know you got it. We see that you've got it, the right spirit, and maybe we can all give you a nice big hug. And,
Yes.
and this is one thing I like doing. This is like, you know, this is giving you a nice big hug. I think all of us can
Thank
do
you
that.
so
Can
much.
we all do that?
Oh my, thank you so much, guys. Thank you so much. Yeah.
I just want to thank Snehal for a very powerful and eloquent talk. I also want to make a point, you know, I've been doing this for a long time now, and I learned so much from my patients. And as you highlighted, keeps things in perspective. And unfortunately, I have to see the story play out many times. But God bless you, kudos to you, and I hope you do very well.
Thank you so much, doctor.
Yes, Nehal, also powerful sharing. Thank you so much. You're a very strong lady.
Thank you, Dr. Lynette.
Keep going. You're doing very well.
Yep. And I think you're getting a big hug from all of us, okay? Right. Okay, so now from everybody else, I'm assuming everybody's giving everybody a hug now and also hugging ourselves, because it's, you know, it's important that we take care of ourselves too, isn't that the message? Yeah. Okay, now do we have some questions as well? What kind of questions? Anybody has some questions for Snehal, Dr. Akhil, or Dr. Lynette, or even Stephanie from what we've heard so far? All right, let's see, maybe somebody is sharing some questions. Okay, so somebody's asked, if a pregnant or feeding mother has breast cancer, does it in any way affect the child? Anybody can take this? Snehal, maybe like, because your baby was just a couple of months, right? When you were diagnosed with the cancer, did it affect the breastfeeding, or would you like to share a bit more?
So I was breastfeeding till the diagnosis, and the doctor just mentioned that, you know, you have to immediately stop breastfeeding. So I had to immediately stop. And anyway, my supply from that breast was going down. So because I was going to start therapy, you know, treatment. So it made, you know, I was not supposed to breastfeed after that.
Oh, okay.
Yeah, but the, you know, so far the milk that was given, or, you know, whatever, I'm assuming that's the question. Yeah, that was absolutely okay.
Okay. Is there a particular reason? I mean, is the blood because of the supply, the milk supply that goes down, or, I mean, and if you could continue breastfeeding, they would be okay, as long as you're not on treatment, I suppose. Maybe Dr. Akhil or Lynette has something to add to that.
Yeah, sure. Maybe I'll go first. So I think it's more related to the treatment. So I suspect when Snehal got the devastating news, she probably was started on treatment urgently, and these drugs are not safe during breastfeeding. And I think the other part of the question was if the cancer is diagnosed during pregnancy, which I suspect is what happened in Snehal's case. It was just diagnosed, the diagnosis was delayed. So this is not very uncommon, and it is a challenging situation. But as physicians, our priority is always the health of the mother, obviously. If the diagnosis is made in the second or third trimester of pregnancy, then usually it is safe to treat the mother with medications and doesn't harm the baby who is developing in the womb. If it happens during or the diagnosis happens in the first trimester, then it is definitely more difficult because the drugs can be harmful to the developing fetus. So it's a challenge, but we have to, maybe Lynette can chip in as well.
I agree with Dr. Chopra. Yes, I've treated pregnant patients before. I've told them that as long as the baby is not in the first trimester, it's actually safe for the baby while the mom goes through chemotherapy, and they have delivered healthy babies after that. So that's still okay. It's better not to delay their treatment too long. Some of them want to deliver their baby before starting treatment, but I tell them that that's harmful to them because then the mom will be sick and cannot take care of the baby properly after that. So it has been shown to be safe for moms to receive chemotherapy when the baby is in the second or third trimester. And as for breastfeeding, I think it's because the chemotherapy drugs just pass into the breast milk, so it's not safe for the baby, but they can still express, and then when they have completed their treatment, they can continue breastfeeding after that.
Hi, can you all hear? I'm unable to hear. I think Parimala, you're. Can you unmute
Here we go.
yourself?
I was
Yes.
muted, was I?
Yeah.
Okay, sorry. How do we know the early signs of any breast lumps? That's the next question. Can Dr. Akhil or Lynette help?
So half of what Stephanie's video mentioned was breast self-examination. So a lady, well, women should learn how to examine themselves so they're familiar with their breast at least once a month. And so when they examine themselves, they will know what's normal and what's not. If they detect a new breast lump, they would know that that's out of ordinary and then seek medical attention early.
Okay. Can I, Dr. Lynette or Dr. Akhil can answer me? Normally they say during the periods, usually we find some lumps and all that. How do we recognize that from the real malignant lumps? Hello?
I think you can't. As long as you feel a breast lump, you should see a doctor. And then the doctor will need to do special tests like a mammogram or ultrasound breast to determine whether or not it is a suspicious lump or not. So just see a doctor if you feel an abnormal lump.
Okay. But there is a myth saying that during the periods, every woman or most of us will experience minor lumps or somewhere discomfort in the breast. So that's my concern. How do we really, because maybe as Snehal and Stephanie has mentioned earlier, that we women, we neglect our health. We don't everything comes first and least is our health. So we normally neglect it and we ignore the early symptoms. So how fast and how fast can we recognize these symptoms or early signs? What is the best, like, what is the earliest thing a lady has to do immediately, other than, yeah, I understand, but like, going to the, sometimes I myself, like, earlier, very long back, when I was reading, I could see some lumps or some kind of hearty, this was long back, but a lumpy kind, but which did not, like, I'm blessed and grateful to God for, yeah. So, but it was like, very hard to explain and differentiate between the malignant tissues or the lumps, the breastfeeding lumps. Sometimes, you don't give feeding, you get the heavier lumps, right? Like I used to feel it. So, yeah.
Yeah, you're absolutely right. So hormonal changes, sometimes women actually have lumpy breasts. However, so it's good to make it a habit to examine your own breast. Usually once your menses has finished, then examine your breast. So like once a month, you examine your own breast, so you know what's the usual hormonal changes or lumpy breast and what's very different from that. However, as long as you feel any lump that is out of the ordinary and you're not comfortable about, don't be embarrassed. Even if it's a so-called normal lump, it may not be. Just see a doctor. Don't worry about it. It's all right to see your GP, just to ask them to examine your breast and see if that lump is serious or not. If the GP says it's all right, it doesn't feel like any abnormal, anything serious, then that's all right. At least it's better safe than sorry. Don't be too afraid. Don't be embarrassed to see a doctor. It's all right to, to see a doctor. Even if you think it's a normal lump, it may not be, you see. So it's a bit better to just get somebody to double check for you.
Yeah, thank you, Lynette, for that. Yes. If any questions, Parimala, you can go ahead with by asking. Yeah, thank you.
Right. Thank you so much. Now, we have another question. How do we know if it's lump or hormonal reactions? Who can take this for us? Lynette, Dr. Akhil?
Well, as a man, I think my answer may not hold a lot of weightage, but I think it's essentially what we have discussed in the past, that you can't tell. But if a lump doesn't go away even after your periods persists and just feels abnormal to the person, I think it needs to be evaluated as soon as possible. And I think Lynette has, very eloquently explained that you know your body best. You should get into a habit of frequent self-test examination. In fact, I had this discussion with my wife last year, and it took me a lot of effort to convince her to get a mammogram now that she's reached that age. So I think prevention is best. If you, God forbid, do develop a pre-cancer, early cancer, as long as you catch it early, treatment options are very good. Chance of cure is very high. I have seen a lot of women, unfortunately, who ignore anomaly, as Snehal has also discussed. The first reaction is denial, and this lump keeps on increasing in size, and by the time the person would actually go and seek medical care, unfortunately the cancer has spread. So there's no harm to go to your GP or any clinician to at least get it evaluated. And the best answer is, if you're wrong, is good that it's not breast cancer. But if it is breast cancer, then you lose that opportunity of catching it early and being cured. And this is one of the few cancers where we have a screening test which is reasonably reliable. Most cancers like pancreatic cancer, liver cancer, there is no test. We can't do it. So often we find the cancer very late. So the statistics that Lynette mentioned in the talk, I think only 20% of breast cancer in Singapore are diagnosed by mammography are concerning, and hopefully this number will go up thanks to the efforts of everyone, including the Breast Cancer Foundation.
Okay, do we have any further questions? Anybody else has another question? Okay, we don't have any further questions. I guess with that, can I say, Padma, you have some recipes that you wanted to share. Do we have some recipes, my dear?
Yeah, so far, because of the weekend and the mothers are so busy, I'm so sorry we don't have any recipes and or participants. So with that note, I think we have come to the end of the whole session. And if you allow me to give thank you note to express my gratitude and thanks to all the distinguished speakers of tonight, I will go ahead, Parimala.
Thank you so much.
Yes.
Please do
First of
invite
all,
us for the Deepavali Sweets Symposium next year.
yes, definitely. I think we will, thank you, Dr. Akhil. And we had a series of, as my chairman, Mrs. Joyce Kingsley has mentioned, that we had about 12 to 14 massive events by our ladies who have starting from the light up all the way till the 1 month, almost 2-3 months. We had 30 restaurants who took part in Biryani Fiesta, and 30 popular restaurants of Little India came in, and they, you can go into Lisha site and you can see it's starting from Delhi Dum Biryani to all the way to South Hyderabadi Biryani, Nizami Biryanis, and it was amazing display of all their biryanis, and that I think every Indian would love to have try out biryanis. So please do drop by when you are in Little India. I'm always there in Little India. And yeah, with that note, thank you so much, Parimala, for giving me, a supportive hand. I know it's last minute, but we made it. And really, again, coming to BCF was supporting organization. Stephanie was there with me, Mio, Alicia, then Snehal Pandey, who has really made a difference in our lives. Today, I promise that every year I'll go. After listening to her story, I made myself a promise that I will go for mammogram. So because I had listening to her story, it has become, I was so emotional, and it was always very scary. Once I went, and after that I never dared to go and check myself. But with that note, I think every woman, everyone who has hit 30s or 40s, please go ahead and get the mammogram done. We have the fantastic doctors with us, oncologists with us. And I have my own cousin who's a chief oncologist in Yashoda Hospitals. He keeps telling me, Padmaja, please go ahead. Like, why do you get that? Go ahead. So with all my doctors and Dr. Lynette, Dr. Akhil joining us tonight and giving sharing your insightful thoughts with us, it made a difference in me, and I promise to do my part. And please take this. Everyone take it serious. Go ahead and get yourself done. It's matter of few minutes to, I think, how long will it take, Dr. Akhil, to get a whole mammogram done?
Probably not more than half an hour.
So please don't neglect your health, girls, and go ahead. And Stephanie, thank you once again, and Dr. Akhil, Dr. Lynette, Snehal, and also not leaving my set of fantastic team of Lisha Women's Wing members who have really helped me from behind in IT and sharing all the Facebook Live, and also the slides. And again, I have my husband Mr. Shankar, in spite of his busy schedule, he being the director of US company, he has, he has often the calls to get back to US office. So he has been there with me and supporting me to go ahead, and we have done it. We have done it very well on this evening, on a weekend. Thank you once again, everybody. We look forward to your support once and again, all.
Thank you.
Have a
Bye-bye.
fantastic
Good evening.
weekend. Good evening.
Bye-bye.
We just did it in 7:42. So it was just in time. Yeah. Thank you, guys.